because of that result percentage and everything. I had completed my first reading itself in 4th year or 5th year somewhere, because I didn't came to India. I was there only in university. I didn't had vacations also. Me myself, Dr. Rameshwar. I did my MBBS from State Medical University. I got in FMG December 2021 attempt. I got 231 in my very first attempt. So I would like to thank whole Prepladder team, especially you, sir, as a medicine king. Then my whole family, and especially to my parents and my father.
It's great, and convey my regards to your parents also, because they have put an equal amount of hard work in bringing you up to this particular stage.
He, my father himself, he's a huge fan of yours. So
okay.
it
Pleasure.
is a
Please convey my regards, please.
yes, sir.
So, Doc, let's begin with your journey. I mean, when did you actually start preparing?
But actually, when did I took admission in university from first year onward, I started preparing. That time, Prepladder was not available, so I was doing it on myself only on self studies. So initially, I started with textbooks. Like I started with all basic science subjects, like for anat, physio, biochem, and patho. I read all textbooks at least once or twice. Especially for pathology, I prepared Robin. So in first or second reading, it was not clear like what we are reading, or it was getting difficult. So we
Exactly.
were
When
just
you
having
read
some.
Robbins for the first time, we don't understand what are we reading. You have said the perfect thing.
Yes, sir.
But here, sorry, I'm interrupting you, because you see, there can be a lot of people who might be saying that, okay, Dr. Rameshwar can be boasting here that I have read Robbins and I've read books. But then, hats off to you. I mean, like, you know, why I interrupted you is because normally in first, second year, nobody is very serious. You know, if I go back to when
Yes.
I was at your age, maybe 19, 20, I was like, no, I was aware there are some exams, you know, I have to sit for a PG entrance exam, stuff like that, right? But then in reality,
Yes.
nobody is really very, very serious. So how did you push yourself? I mean, is it a culture in your college that everybody reads books, or you were the, I would say, the bright one who was doing it? I mean, what really pushed you to do this is what everybody would like to know, and would definitely like to, you know,
Yes,
troll,
sir. I
because
got the
everybody
point.
loves to
Yes.
troll nowadays. So they can troll you and saying, okay,
Yes, sir. I got your
what,
point. Like, sir, when I completed my 12th, I didn't have any attempts. So it was my first attempt. I didn't did any coachings at 12th only. I just had one crash course, and then I went through like, okay, now let's get settled, and I will go abroad and I will study there. So when I went there, so I thought like, now anyhow in future we have to choose one governmental college at least for NEET PG. So in that issue are also that time for FMG, you knows that now result is quite good, but that time was the pass percentage was also less. Now it's increasing day by day. So because of that fear, we can say, or like always there was a some motivation was there from my father also. So he was also there to keep me motivated. He was also there. So basically, it all started with all these things. Not a single thing is there. We have some. We have to do like we have to achieve something. Someone is there to support us. So all these things works, and I was doing it like, okay, day by day. This is a long journey. We cannot achieve it like 6 months. Some students used to say like, I studied for 6 months and then I cleared. No, they also had studied somewhere.
yeah,
They
yeah.
also had put their hard work
We
earlier
should
in their
not
life.
take their
But
credit away, but yeah, I
yes,
mean,
it is not a like a short process. Slowly, it will get increased. We have to gather the whole knowledge, and this time paper was also like that only, conceptual. Like I would like to say like whatever I read for 13 to 14 days, only small topic that covered, but whole 6 years, what concepts I gained, that concepts were there. So it is a long journey, long process. We have to keep ourselves motivated. So that was happening.
so like, you know, once you come closer to the exam, let's say 4 months before the exam or 3 months before the exam, you would have completed one reading, I presume. So, or did you not? I mean, let's be clear on that. I mean, when did you complete your first
Sir,
reading actually?
I would like to say it like I had, because of exam fear only, like not like I am so talented or I am so studious or something like that. Because of exam fear, I will be straightforward. because of that result percentage and everything. I had completed my first reading itself in fourth year or fifth year somewhere, because I didn't
Wow.
came to India. I was there only in university. I
Okay.
didn't had vacations also. In COVID time also, like we got too much time for self studies, so everything was closed. So we got too much time
Ample time
that
to
time.
study.
So I have completed like in fourth year or fifth year, sir. I can say only some small subjects were remaining for like radiology and dermatology. They are also like clinical subjects. If you didn't study them, still 50% part is scored by other subjects. So that also like that only. But whole syllabus I will say like in fifth year starting I had completed. So from that I got 1 point, like for any exam, if you want to crack that exam with high score or with good rank, your syllabus should be completed at least 1 year before that exam, so that you can get the overview or we can get enough time to revise that syllabus.
Right.
So that thing really happened with me. I completed the whole syllabus before 1 year before the exam. So I got like I attempted grand test before that also. So that time also I was getting passing score, not that high score, but passing score I was getting. So I gave Prepladder at least 15 to 20 grand tests. My score was not increasing in 2 to 3 days or 2 to 3 weeks. It was increasing 3 to 4 months. Sometimes it was like 150. I started from when I gave first grand test in fifth year starting. It was 149 first grand test. So I was shocked. Like 149 is a dangerous number like here for FMG itself. So I started preparing from there. So it was increased like 155, then 160, 180, then again 165, 150, again 160 like that. And in like last 3 to 4 months, last 6 months, it was consistently up to 190, 195, 200 somewhere like that.
Great.
That's
Great. So like normally what I see is people tend to keep on pushing everything till the end. कि last में कर लेंगे, last में कर लेंगे. You did everything in advance so that you could actually push up your
yes,
score to a great level. Okay, but then डर तो सबको लगता है. I mean, everybody is afraid.
yes, sir.
So like, let's say 3 months before the exam, how many hours per day were you studying?
Like I can say like at least 8 to 9 hours, 3 months before exam. Seriously, 8 to 9 hours I was giving,
That
and for
that
like
is all
last 1 month.
inclusive sitting. That is 8 to 9 hours of sitting or 8 to 9 hours of effective.
Not so effective. I can call 6 hours were totally effective.
Effective.
8 to 9 hours
Effective.
were like some party there like we were watching old videos. We were watching like having less time. We were watching old videos, recall questions. That is like passive reading only, not active reading. Will call it. Actively, we were doing it for 6 hours only. I was sitting for 8 to 9 hours, but we know that whatever we will gain or whatever active learning is happening, that was only about 6 to 7 hours, not for that whole time whatever you have said. Like each second is not that much active learning. Sometimes 3 to 4 hours I was giving like,
Okay.
but learning was there.
Okay. So normally जैसे होता है कि भाई when you go into the examination hall, everybody is afraid that पता नहीं कैसा पेपर आएगा.
Same
You know
thing
that.
happened with me. Yes.
Yeah, yeah,
I
yeah.
would
So
like
when
to interpret here, sir. When I went to first session, like my up to here, I gave grand test, so many grand tests, and the score was quite good. 190, 192, 195. Like I knew it that I will pass exam, and I know that the score will be also like little good side. Like you will say like your words were there before exam. I want that everybody should score more than 200, but it will not happen ideally. So I remember that words also. So I was expecting the score, but suddenly when I went to the exam hall for especially for first session, so I got panic. My heart started pounding. I was having palpitations. Even I cannot hold that water bottle that the people provided us in the exam hall. So that
okay,
happened for me 20 seconds. And my first question was to that was so easy question, like it was on daily RAM 3 months. Classical question, classical options, classical history was given. Alcoholic patient, like it was so easy question, but still I was having panic attacks. Like I don't know what is this happening with me, but still I managed. Next question was little hard. Then again it was increasing, but after 15 minutes it was getting
stabilize.
settled, and so I get relaxed, and then I started real exam after 20 minutes. So it happened with me, and I was shocked after first session. Like what was this happening? I should have control over it, and then for second session nothing happened. So it was like, sir, nothing else. It's just the exam hall stress or exam hall anxiety, we will call it. Nothing else. So we have to practice that. We have to take in mind nothing is there. It's not too difficult. If we can do it, then anyone can do it.
So were you able to finish paper one on time?
Yes, sir. generally what happened, I thought I will get enough time after completing. So for like for practicing exams, I was getting 1 hour enough to rewind. So in paper one, I got only 25 minutes after completing. So I just checked mark for review questions there. I didn't did any changes.
Good. That's a
I just
pertinent
keep it
point.
like that only.
Yes,
I
yes.
didn't any did any
Yeah.
changes.
Please
Just for
repeat.
mark for review questions. Yes.
Yeah, Doc, please repeat this point for everybody who's gonna listen to this. Do not change the answers to the questions that you
Do
have
not
marked.
change the answers. And when I came home after the finishing exam, I feel myself proud. Okay, I did this thing very rightly. I didn't change the options only for except one question. I remember like for plague in incubation period there was a question. So that small thing I did, but I remember in exam hall also, and last time toppers also told don't change answers in the last sitting. So I didn't did that thing, and that really worked for me, because in last minute we want, like we think, "Oh, this is right, this is wrong," like that that thought comes in everyone's mind. So that same thing was happening with me, but I still managed it and I didn't change any answers, and that really worked for me.
Great, great, very nice, very nice. So it's been an interesting journey right from the first year, and finally you have achieved this target. So I would definitely, I mean, I appreciate your hard work and the things that you said, and you made it sound so simple, though it's much much complicated than that. So any special piece of advice to your juniors, because they'll be filling your inbox with messages.
Like yes sir, I would like to give special advice to like first year, second year, third year students. Like in final year they will now manage themselves however they have to manage, but for first
Anyway,
year, second year, or to third year students, they have enough time now. Focus on concepts only. Don't go with like directly to one liners or lectures. Like, you should focus on core concept there. Like sir, when we used to read leukemias, if you will go in books, we will start reading these blood cancers. In first reading, we will not get anything. But so we will think this topic is very hard. But when we will get proper guide, like if you will watch your lectures, how simple you made it. We have to remember at least age group. If you will remember age group, classical presentations are there. Acute myeloid leukemia, classical presentation will be there. So we
yeah,
have, if your concepts are clear, so we will get that words in our questions only.
yes,
By listening to your words, lecture words, we will get it by solving so
yeah.
many questions. So
Yeah,
subconsciously
he
everything
had
gets
that
built
thing,
up.
no spleen going up to the umbilicus,
Yes,
shift to the
yes.
left. I mean, those classical words are anyway there. I mean, that's
Classical.
classical
This
present.
time also same thing happened. For at least four questions were there on leukemia. I can say like all leukemias covered this time.
Yes, all leukemias were covered. And people were saying all four were CML, but that was not the case actually. It was. I mean,
Like
all were covered.
different leukemias. Acute was also there, chronic was also there,
Yes,
myeloid also there.
yes,
So this thing like, so how this thing will happen? We have to start earlier preparation. So if we will start preparation early, we will start solving questions earlier. So we will start committing mistakes earlier. So it will be benefited for us. Like if we will commit these mistakes early, so we will get enough time to solve them also. And one more thing, sir, custom models, the new feature that Prepladder have started, custom models,
modules.
they play a huge role there, because practice is everything. If you will
Absolutely.
practice every questions, like we get subconsciously, we don't understand how that thing came into our mind, or like it's chronic process. We have to go it long process. We have to solve. I was like from last 1 year, anything happened, but I had attempted at least 100 questions daily. 100
Wow,
questions for custom model, and
wow.
I was using that feature, uh, that tag feature. If you will tag recent questions, or especially for aims and recent NEET PG questions, if you will tag them,
Yeah, they were
nothing you
repeated.
have to do.
Yeah,
If you will,
yeah, yeah.
yes,
Absolutely,
repeated
absolutely.
questions, the question will not repeat, but concept will definitely repeat.
Yeah. If
Everything was
you
from there
guys,
only.
the guys are neglecting, they don't go through NEET PG and these INI-CET and AIMS questions. But the point is, they think that question is hard. The point is that line of that question. I mean, there's a possibility. I mean, obviously, he'll not make it as hard as INI-CET paper, but at the same time, I mean, that line, whichever we discuss in INI-CET paper or maybe in NEET PG, that thing is replicated here, because disease will remain the same, no? After all, the diagnosis will remain
Yes,
the
sir.
same. So that is what I think that, and you have done a perfect thing. I mean, you are a perfect example of how a student should be approaching when he's in first year, second year, third year, and then going towards the final year. So, congratulations, Doc, for an excellent score of 231. And God bless you. And I wish you success for your future also.
Thank you so much.
Okay, okay.